So, talking about the Norma occipitalis, as I've already said, when the skull is observed from the posterior aspect, it is known as Norma occipitalis. Now, what are the bones that take part in formation of the Norma occipitalis, as you can see here? So, we have this is the occipital bone, the squamous part of the occipital bone, two parietal bones, and we have this portion that is known as the mastoid portion of the temporal bone. So what are the bones you see here? Here you see the occipital bone, the parietal bones, and this portion that is known as the mastoid portion of the temporal bone. This area, the Norma occipitalis, is convex upwards and flat below. Now, what are the different sutures you see here? So the different sutures we see here is that we have lower part of the sagittal suture between the two parietal bones here. We have the lambdoid suture between the parietal and the occipital bone, and here we have suture that lies between the mastoid part and the parietal bone, and the mastoid part and the occipital bone. So we have a occipito-mastoid suture, this one, and we have a parieto-mastoid suture, this one. So we basically have four sutures here. On the Norma occipitalis, we see the lower end of the sagittal suture, we see the lambdoid suture, we see here occipito-mastoid suture and a parieto-mastoid suture. Now, what are the different features you see here? Now, here we can see we have a prominence here, this portion. This is known as the external occipital protuberance. It is a midline protuberance on the lower part of the Norma occipitalis, and it marks the junction of head and the neck area. On this portion, we have a most prominent point that is known as the inion. The trapezius originates from this part, and ligamentum nuchae begins from this part. From this part, we can see we have three lines. This is the superior nuchal line, the inferior nuchal line, and the highest nuchal line. Basically, from the external occipital protuberance, a line moves downwards. This is known as the external occipital crest. We have a highest nuchal line, a superior nuchal line, and an inferior nuchal line. The highest nuchal line is not so prominent. What is attached to the highest nuchal line? Epicranial epineurosis is attached to it, and the occipital belly of the fronto-occipitalis muscle arises from the lateral two-third. The superior nuchal line, this one, as you can see, the superior nuchal line, it starts laterally from the external occipital protuberance. It marks the junction of head and neck area. The trapezius muscle originates from the medial medial one-third, whereas sternocleidomastoid is inserted into the lateral two-third. Then we have this line that is known as the inferior nuchal line. The inferior nuchal line is situated below, it passes from the midline of this line, that is the external occipital crest. This portion, the inferior nuchal line, is not considered in the part of the Norma basalis, in the Norma occipitalis. Now, here you can see we have a mastoid foramen. This is a foramen here. This is known as the mastoid foramen that lies at the occipito-mastoid suture. It opens inside into a sigmoid sulcus. What passes through it? The emissary vein and the meningeal branch of the occipital artery passes through it. So, to revise it again, we said when we look at the skull from the posterior aspect, this is known as the Norma occipitalis, formed by four bones, formed by the lower end of the parietal bones, the occipital bone, and the mastoid part of the temporal bones. Talking about the sutures, this is how you have to define this part when it's asked in the exam. The lower part of the sagittal suture, the lambdoid suture, lambda. Here we have mastoid और occipital के बीच में occipito-mastoid and parieto-mastoid